What's up, YouTube? It's your girl, Janice Life, and I'm back with another video. I am here today to do a video. I am on my way in the doctor's office. But I wanted to tell you guys, I got my surgery date. Yes, I have my surgery date. My surgery date is March 2nd. I will be having surgery. That is my skin removal from my upper part of my body. Yes, I am finally getting ready to do it. I am getting ready to get my arms done and my flanks done. So, I'm going to take you guys along with me. So, subscribe to my channel, give me a thumbs up, and hit that notification bell because you want to see this. If you're considering doing any type of skin removal surgery, cosmetic surgery, to your arms, which is a brachioplasty done to your arms, and a flank surgery, you want to see what's going on. You want to see how I recover. You want to see if I'm in a lot of pain. So hit that bell. Give me a thumbs up. You hit that bell, you'll see me go through it. I am going to also start doing some live so you guys can see what I go through on a day-to-day basis through my recovery. So, I'm not good with editing, okay? So, I'm going to start doing some live. So, like I said, hit that bell for the notification so you won't miss my videos. Give me a thumbs up, okay? And subscribe to the channel. So, next time I turn on this, I will be in the doctor's office. Today, I had to do 2 visits. I did a bone density test, and I'm getting ready to go see the sleep apnea doctor and / pulmonary doctor. So I can get my clearance for surgery. Also, I have to see the cardiologist so I can get my clearance for surgery. So I am seeing several doctors, pre-admission doctors. So you will be seeing little clips of me, little videos of me as I go to these different doctors' visits. But on March 2nd, that's my surgery date. I will take you guys along with me till we get to the actual door. Of course, you can't go into the surgical room. But once I have surgery, someone will start filming, what is going on after my surgery. Once I come out of the anesthesia, I will pick up the phone, my camera or my phone, and let you guys know how I feel. And from that day on, I will film me bandaging my arms, letting you see the scar, and all of that. So, stay tuned to my channel, and I'll talk to you guys later. Okay, I've made it in. I am in the clinic now. I am waiting for the nurse to call me. Like I said, it's a lot of things that I need to do, like get bandages, my ACE wraps, get my hair done. I'm going to get it braided because I can't lift my arms for a couple of weeks. So it's a couple of things I need to get done. I know my lighting is not good because the clinic I'm in is basically glass. You can see. The clinic is basically glass, so my lighting is not good. So I'm just waiting for the nurse to call me, and then I'll be back there to see the doctor. So, I hope everybody is staying prayed up, masked up, washed up, and what else? Okay, prayed up, masked up, washed up, and backed up. They were calling the patient, and I couldn't hear.
But like I said, everything is going great with me. I am down to 178 pounds. I got to keep that weight on so I can have some fat to transfer. So I am not trying to lose any more weight. I never thought I would hear myself say that. I am not trying to lose any more weight. Never thought in years I would ever hear myself say that. I am almost down to my high school weight, and that is hard to believe. Um, um, a c about 3 or 4 weeks ago, I had a flare up with my lupus, but I'm doing better. I wasn't able to work, and I was kind of sick. Okay, not I shouldn't say kind of. I was really sick. I was real weak. They COVID tested me, but that was negative. But thank God. I thank God for that. And everything else is okay. Um, I am trying at this time to continue building muscle and working on my muscle. So, like I said, everything is doing awesome. And I hope everybody else is doing awesome. And I wish everybody good health. And I hope the first of the year is doing great. So stay prayed up. Keep God first and everything else secondary. And I'll see you in the back.
And how tall are you?
I am 5'8.5".
Okay.
My current weight.
And that's at least 250 pounds.
Yes,
give or
I've
take.
lost over 250 pounds.
Okay, well that's a massive weight loss.
Yeah.
And you have kept it off mostly?
Yeah. I one
And
time
you
I
did-
gained up a couple of pounds,
Okay.
but I was on steroids,
Okay.
and then I dropped it back off.
Okay.
So I watch what I eat. I especially in the summertime, I'm walking like 2 miles.
Okay.
Okay, I'm up to 2 miles.
Okay.
I just basically I work out. I have fibromyalgia,
Right,
and right, and so I'm constantly exercising,
Right.
and
And you feel good?
I feel awesome.
You feel
I
good,
recommend the surgery
Yeah.
to
You
anybody.
had your surgery done at University of Chicago?
Yes, I had it done at university.
And that was
My
2000
follow-up care is going to be here.
Yeah, okay. And that was in 2015.
Yes.
Now, you had a sleep study done back in 2016 as well. There's a mention of that. Now, did you have a diagnosis of sleep apnea prior to your surgery? When was that established? The first time?
The first time they established sleep apnea was 2000 and I think it was 2012. I think it was.
Okay.
Yeah.
And did you have severe sleep apnea?
To the point where I could just like I would wake up
You wake up
and
gasping?
couldn't gasping.
Okay. And those kind of things don't happen anymore?
No.
Gasping?
No.
Okay.
The gasping, actually I could lay flat.
Okay. Now you still use the CPAP, right?
I was until the machine.
Kind of broke down on you?
Right. Well, till they told me the last time I used it, like I said, I got that bad sinus infection, and I stopped using it because
How long ago was that?
that was I kept getting bad sinus infections. It was before COVID started.
So about a year ago.
Yeah, before COVID started.
Okay.
I got it before COVID. I got the real bad sinus infection. They had to put me on medication.
Okay.
Then it cleared up, and then I got another bad
You had
sinus
some,
infection.
Bad reaction to a couple of medications.
Yes.
So Xolair and Dupixent.
Oh yeah, those were the medications that the allergist was giving me.
Okay.
And because I have a lot of allergies,
You still suffer from a lot of allergies?
Oh, yeah.
Okay.
Now that didn't, I've been suffering with allergies since can remember, since I was a little girl.
Even, as a child?
Right.
Okay. No other lung problems?
Asthma,
Right.
COPD.
Okay.
I was diagnosed with asthma and COPD.
Okay. Have you been a smoker?
No, but
Never smoked?
no. The only thing I can tell you is that I've been intubated at least 7 times
For asthma?
for asthma.
Okay. When was the last time you were in the hospital for asthma?
The last time, it's been over 2 years now.
2 years, okay. So past couple of years have been pretty good for you.
Yeah.
Good.
Excellent.
I'm glad to hear that. You live by yourself? Anybody have a chance to watch you when you're sleeping?
My son.
Son,
Uh-huh.
has he mentioned that you have any choking episodes, or do you feel that yourself? You said you don't. So. But
Well,
has he mentioned anything?
nobody has mentioned anything. My husband hasn't mentioned anything of me.
And you don't.
Choking.
You're not waking up gasping or choking.
Every once in a while, I may
Occasionally.
wake up. Occasionally, I may say in 2 months, I may wake up gasping,
Okay.
but it could be like the weather is changing, the
Okay.
season is, or I may have a cold, trying to come
Or
down
could
with a
be some
slight
underlying
cold.
reason for
Right.
that. Okay.
The allergy. I
And-
have a puppy, and I
Okay.
can tell when I need to take him to the groomers and have him washed
Okay.
because
Then
I
you
noticed.
start to react to
Right.
the hair and things like
Mm-hmm.
that. Tell me about your sleep habits. What time you typically go to bed?
Oh God! Now that is the problem that they have noticed. I was seeing what is it? A sleep psychologist or
Yeah,
something.
there are clinical psychologists.
Right.
who-
Because my sleep habits are horrible,
Okay.
and I had a sexual assault years ago, about 14 years ago,
Okay.
and I was scared to sleep
Okay.
in the dark, so I would leave the TV on.
Okay.
I've gradually now turned the TV off, but I do not sleep normal, where most people may get 6 to 7 hours of sleep.
Right.
A normal sleep for me is 4 hours.
Okay. So that's your
that's
typical length of time.
Typical length of time. Only time
Do
I'll
you have a set bedtime, or it's not really any routine that you follow?
now what I was doing, I had did a sleep log.
Okay.
I had started doing a sleep log where I know not to drink caffeine.
Right.
I know not to exercise
Close to
before
bedtime, like
close
you
to
do.
nighttime. I would turn the TV off, or I would dim the lights, read a book, something to calm me, meditate me. I
Okay.
even have the Bible app on my phone where I'll listen to things and to try to sleep. It helps sometimes, but then
It
sometimes
doesn't. Yeah.
it doesn't. But once I'm awoke, or if somebody make a noise, and the thing is, if somebody makes a noise,
Then you are.
I'm up and I'm up.
Yeah. Then you have
I can't go back to sleep.
Okay.
Right.
So again, coming back to the original question, do you follow a routine, some kind of routine where you say, okay, my bedtime is like 10 o'clock or 11 o'clock?
With me working sometimes till 11, I would say my normal bedtime is about 12:30.
So it's past midnight.
Right, it's past midnight, and no matter what, I'm up at 4.
So you still get up at 4 no matter what time.
No,
you
if
go.
I go to sleep at 2 o'clock, I'm up at 4.
Okay.
It's like
Do you try to go back to sleep when you
I
go to
try,
sleep?
and it won't. It will
doesn't
not
happen.
happen.
Okay.
It will not happen.
On some nights or at times when you are able to sleep longer, how much are you able to sleep? Or you are not? 4 hours the max.
That's the max. And if I lay there, I'm just gonna lay there, and I'm just gonna toss and turn. I'm lay there, and I just get up because
come to you. Yeah.
right, it's not gonna come back. The sleep, it's like once my eyes open, that's it.
Now, is there any need to use the bathroom that wakes you up from your sleep?
Nope.
No.
Because I usually empty my bladder
Before you go
before
to
I go
bed.
to sleep,
Okay.
and no.
No. Okay. And So 4 o'clock you wake up, so you get out of bed. Right?
Yep.
What do you do?
Usually I go and I read my Bible.
Okay.
And then after that, I sit and I meditate.
Okay.
And then I take my shower.
Okay.
And
Do you nap in the daytime?
no.
No.
That now I've tried to do that. I've tried to lay down
Right.
and take a nap because
Okay.
a lot of times people say, "Oh, you look tired," or my sons are like, "You look tired, Ma. Go lay down." I try,
But it doesn't.
and I
But you're not able to fall asleep.
no, I even tried what's that melatonin?
Melatonin?
Right. I've even tried to take that and because I have that on my medication list.
That doesn't help?
That helps. Only thing I noticed, I was at one time doing Benadryl, but I know that's not good for me to do.
I mean, it shouldn't be used longer term. I mean, here and there, once in a while, it's okay, but
Right.
it shouldn't be relied
Right.
upon.
I have hydroxyzine on my. I do that if I feel that I just need to get some sleep.
Right.
I will take a hydroxyzine,
Okay.
and that will put me to sleep. But where hydroxyzine will probably make a normal person sleep 8 hours,
Right.
it's still.
That's still
Sometimes I have to take 2 of them to really knock me out to go to sleep.
Okay. Now, are you mostly a back sleeper or are you a side sleeper?
I used to just sleep on my side. Now I can sleep on my back. I can
Okay.
sleep on my stomach. I can sleep.
Since you have lost the weight.
Since I lost the weight, I can sleep in any
In any position.
in
that
any
you want.
position. Right.
Do you feel that most nights you don't get enough sleep or that 4 hours is enough for you?
Ooh, I feel I need more
Need more
sleep,
sleep, but you're just not able to.
but I just can't get it.
And this has been a pattern for you for many, many years.
It-
Even before you had the bariatric surgery?
That was since when I gained the weight and I was doing it because it used to be that I could hear myself
Right.
snore. Snoring would wake me up.
Right.
I would also have that sleep where you would sleep and it was like a paralyzed where I could hear people talking.
Right.
I could hear everybody talking, but I can't move. And then I would jump up.
Sleep
Right.
paralysis type of a
Yeah,
thing.
the sleep paralysis,
Do
right.
you suffer from a lot of fatigue, like lack of energy?
When I don't get enough sleep. So it's like when I go say for instance, I may not go to sleep till 2:00 in the morning.
Right, so when it gets even further later,
Right, and I get up at 4, and if I have 2 or 3 days like that,
then you would.
yeah.
Do you get headaches?
Oh, yeah.
Yeah. Do you wake up with headaches sometime in the morning? Okay. Do you feel a lot of dry mouth?
Yeah.
Yeah, okay. And does your nose and sinuses get stuffy in the middle of the night?
Mm-hmm.
Yeah. Okay. Caffeine consumption?
I may drink a cup of coffee or because, the pop and stuff I can't drink with the gas. If I have pop, it's watered down.
Okay.
Coffee, I may have a cup of coffee maybe twice a week.
Okay,
Maybe.
So very occasionally.
Very
So there's
occasionally.
not
No, not an everyday thing.
Not every. Any smoking history?
No.
No. Okay. Alcohol use?
No.
None at all?
Mm-mm.
No.
No, because I couldn't drink before, and now if I try to drink, it goes right to my stomach and knocks me. Yeah.
Problem, yeah. Any family history of sleep problem, like sleep apnea in the family?
My father had sleep apnea.
He's on CPAP?
Well, he passed, but
Oh,
he
he
was
passed.
supposed to be on sleep app, but he
didn't
never would do it.
Has driving been a problem for you as far as drowsiness is concerned?
No, or falling asleep at the wheel and no.
Nothing like that. If you're a passenger in the car, long distance driving?
Oh, now if I'm a passenger in the car, long distance driving, I get drowsy.
You do get drowsy?
I get drowsy, yeah.
Okay. Would sitting on the couch in front of the TV, just watching, sitting there, relaxing, would make you drowsy?
Basically, if I'm watching a movie
Right.
and it's boring,
Yeah.
I may
Kind of
doze off, but I'm back up.
Okay.
It may be like a quick little 20-minute sleep, and then
Okay,
I'm
then
I'm back up.
Okay. Okay. I get it. Okay. So a couple of things here. The information that I have as far as your sleep study is concerned, I don't have the 2012 sleep study
Okay.
report, so I don't know how bad your sleep apnea was, but you had a sleep study done in 2016, which actually showed a very mild sleep apnea.
Yeah, they told me it's mild
Your
now.
index was just 5. That number 5 indicates the amount or number of times the breathing would slow down or stop altogether for 10 seconds or longer per hour of sleep.
Okay.
Normal is less than 5, so you are just barely between normal and what we call as abnormal.
And that's good because
Which
it
is good.
Right.
And 2016 would have been probably a year after your bariatric surgery.
Okay.
Then last year in August of 2020, they did a home sleep study on you, which again showed that you have a mild sleep apnea. Your index of sleep apnea was 9.9.
Oh, okay.
So we are comparing kind of apples and oranges here.
Okay.
The sleep study in 2016 was an in-lab study.
That one was at home, and I couldn't really
Right.
rest. Right.
So and just to let you know that we don't always treat mild sleep apnea.
Okay.
Mild sleep apnea gets treated when somebody has risk factors
Okay.
like heart disease, history of stroke.
Okay. Well, I had a stroke before.
Right.
I had a stroke
Right.
years
So
ago.
history of like irregular heart rhythm, like atrial fibrillation.
No, I have.
Or very severe symptoms, like even though the number is very low, but you still suffer from severe sleepiness during the daytime. Now your situation is more indicative of an insomnia type of a problem, and a chronic insomnia type of a problem, which has been going on for several years.
Right.
Now, in cases like yourself, when you were extremely heavy at some point in time and you end up losing more than half of your body weight,
Yeah.
it can have a lot of impacts on the body, including how you sleep.
Okay.
And sleep pattern or sleep architecture, as we call it, once it gets disrupted, it's not always easy or quick to come back to a normal. And sometimes it never comes back to a normal.
Okay.
What do we need to do at this point in time? I think we need to make a decision whether you need CPAP or not.
Okay.
The best way to do it is to have you undergo an in-lab testing. Like we have you come in and sleep in our lab overnight. A portable study is not always completely indicative of what's happening in your sleep,
Okay.
especially with your insomnia history.
Okay.
You have short sleep time, like 4 hours at best. I'm not sure if you're having anything else happening, like body movements or leg
Well,
jerking.
the kids, my grandkids, always saying
That your legs are moving.
my legs are constantly moving. Like they said, you look like you're riding a bike.
Bicycle. Yeah.
Right.
So those are the situations which can be indicative of certain sleep disorder which may need to be treated differently, or they can be part of sleep apnea. The only way that we can really clearly define that is to have you undergo an in-lab testing.
Okay.
In-lab testing involves you coming and sleeping in our lab overnight. What we generally do is
Because
that-
I've even bought a weighted blanket
yeah.
because
Just
with
to
my
keep them
legs
like that.
moving, and just to put on my legs to keep them from
Moving
doing
more,
that.
yeah.
Right.
Yeah, but still you still have. Do you notice that? Do you feel that when your legs are moving?
Sometimes because my puppy, he sleeps down there, and I have
Okay.
kicked him off the bed.
I see.
Okay, so I know that.
Involuntarily, right?
Right.
Yes,
It is. I don't know until I hit it, but he go, "Ay!" or if my grandkids or somebody is in the bed with me, and they're like I'm kicking them, or right,
Then you would.
right, and they're like, "Dang, you kicked me, you moving so much at night," and I'm like, I don't know it
Right.
until they tell me like,
Until they tell you. So you are not always aware of
No.
the situation.
no,
So yes, so that can be a situation which is called periodic limb movement disorder. It's a leg movement problem. Sometimes we see in certain situations, like when people have iron deficiency in the body, certain neuropathy, like a nerve problem.
well, I do have that
Yeah.
with my feet
Right.
because.
Neuropathy.
Mhm.
And many times people have neuropathy, type of symptoms after bariatric surgery, because when your stomach is bypassed, you start to lack certain nutrition.
Right,
in
the
the system.
different vitamins and
Right.
stuff. So I
And
know.
that can impact your nerves.
Okay.
So that we can only assess by having you undergo an in-lab testing.
Okay.
Lastly, if it turns out that you have pretty mild sleep apnea and the decision is made not to put you back on the CPAP and you continue to have these sleep problems which are off and on bothersome for you, then one option would be to see a clinical psychologist these are the people like you've seen in the past,
right,
who have expertise in doing therapy, non-pharmacologic therapy for insomnia.
Okay.
It's called cognitive behavioral therapy for insomnia, CBTI for short.
Okay.
And these are therapy sessions which are done by those clinical psychologists who perform that.
Okay.
Unfortunately, we don't have anybody consistently available at Loyola actually.
Okay, I got cleared for my surgery. The doctor cleared me. I do need to sleep study, and they're going to schedule that. Excuse me. Thank you. Bye-bye. Thank you. Have a nice one. I am on my way home. I have seen 2 doctors today, and I am ready to go home. Yes, I'm ready to go home. I worked last night and I am tired. So I am going home. I will be off from work for some weeks. So just to let you know, when you, I'm about to fall. When you have this type of surgery, you can be off 3 to 6 weeks for this type of surgery. You won't be able to lift anything. You won't be able to lift. Let me see. There we go. You want to be able to lift anything over a gallon of milk. Like I said, I have to get my hair done because I won't be able to lift my arms. I'm having a colonoscopy Monday. And what else am I having done? I have another appointment. Monday too. I have another appointment. But anyway, like I said, I'm taking you guys along with me as I do my appointments. So this is the end of my video. I hope you guys enjoy it. It was just really an update on when I'm having my surgery, and I had a pulmonary appointment, so I just took you guys along. Like I said, I'm excited. March 2nd is just around the corner. I'm just ready to do this. So thumbs up this video and subscribe, share, and you all have a blessed day. And remember, God first and everything else is secondary. Love you guys. Talk to you later. Bye.